say, you might have our legislative champions come on up too. All right, well, thank you all for coming today. I very much appreciate it. Welcome to the party. You're welcome to wear a hat. My name is Dan McGrath. I'm the Executive Director of TakeAction Minnesota. Before I introduce our other speakers, I'll say a few words here. Starting tomorrow, September 23rd, there are a number of very important and very powerful new rules going into effect that will restrict some very bad health insurance industry practices. So today, members of the Healthcare for America Now Coalition, state legislative champions on healthcare, official from the US Department of Health and Human Services, and most importantly, Minnesotans who are going to immediately feel the most positive impacts of federal healthcare reform are here to say farewell to insurance abuses and to eat some sheet cake once we're done with all. The new Affordable Health Care Act provides Minnesotans with new protections against some of the worst corporate health insurance abuses around. We've gathered here to say goodbye and good riddance to some of the worst, including high-cost co-pays that stop people from getting preventative care, insurance companies standing in the way of patients and their doctors, young adults between the ages of 18 and 26 who've been living without health insurance, annual limits on health insurance coverage, lifetime dollar limits, denying kids from getting coverage based on pre-existing conditions, and rescission, the idea of taking back arbitrarily health care coverage once a patient becomes sick. Our members and coalition partners have worked for nearly 2 years to help pass healthcare reform to stop some of these abuses and really stop the corporate stranglehold on our healthcare. And finally, to put some new rules in place. So starting tomorrow, people will be able to start seeing these very real benefits for themselves. I'm going to introduce Mark Brull, who is one of TakeAction Minnesota's leaders from Edina, who's been leading on our work around healthcare, to talk about what the Affordable Health Care Act means for his family. Mark.
Thank you. I apologize for reading, but I'd messed this up. So. I have a 9-year-old daughter, Maya, who has epilepsy. She's just one of the 3 million Americans who have epilepsy. She had her first known seizure at 3 years old. Maya has what is known as intractable epilepsy. In other words, modern medicine is not yet capable of controlling all of her seizures. She needs to take 5 anticonvulsant medications twice per day, along with other medications, and they still can't stop her seizures completely. Those medicines alone cost in excess of $1,500 a month. If she has a seizure that goes on too long, meaning longer than about 5 minutes, the medicine required to stop that seizure can cost anywhere from $425 to over $750 for only 2 doses. That's enough to stop only 2 seizures. Many people with epilepsy have many more than 2 seizures a day. Maya has just had a VNS implant, a device that has a 66% chance of significantly reducing her seizures. Last week, she was in the hospital for 4 days in an attempt to diagnose and treat a new type of seizure she's recently developed. Maya does not have it easy. She can be felled by a tonic-clonic seizure without knowing what hit her, or instantly dropped to the ground by a monoclonic seizure in her legs, or completely debilitated by a ferocious seizure-related headache and its accompanying symptoms. A seizure that cannot be stopped can have very dire circumstances. Epilepsy also affects her security, her safety, her well-being, and her self-image. Fortunately, Maya's a pretty wonderful girl who handles all of this pretty gracefully and still remains a sweetheart. Of course, I am rather biased, and my objectivity in the matter could fairly be called into question. I've been laid off. If something happened to my wife's job or insurance, how would Maya and the rest of my family survive if suddenly we could be denied health care coverage due to a pre-existing condition? Thanks to the health care reform that President Obama has signed into law and that we are celebrating here today, that is one terrible fear that has been removed from our horizon. Many have lost sight of the fact that insurance is money that is pooled to be spent when it's needed. That money should not be fodder for games of speculation and profit. It's easy to forget that the money paid to deserving physicians, nurses, hospitals, and yes, even pharmaceutical companies is our money, not the insurance company's money. It comes from us in the form of the premiums we've paid, and if we're lucky, that our employers have paid on our behalf. It's the money we've pooled to be used when we need to be healed. Healthcare should not be a gift. Healthcare should not require charity. The doctors and nurses and companies and innovators who take care of us and heal us deserve compensation for their dedication, hard work, and endless responsibility. A just society assembles a system where those who cure and those who need to be cured can both be treated with fairness, dignity, and responsibility. A just society assembles a system where those who cure and those who need to be cured. Oh, I just repeated that, I'm sorry. The end of denials based on pre-existing conditions is a huge step in restoring justice and fairness into our healthcare system. Congratulations to those who have worked so hard to obtain that fairness, and congratulations to the American people who deserve the bounty of a just society. And to those of you who have worked so hard on our behalf, my family, and especially Maya, thank you.
Next, I want to bring up Julie Olson of Minneapolis.
Hello, everyone. My name's Julie Olson. Thank you for the opportunity to speak to you here today about the benefits I will receive personally as a result of healthcare reform tomorrow and in the future. I'm a 23-year-old college student. I have a rare illness called dysautonomia that I've suffered from since I was a young girl. My symptoms became more severe after suffering the trauma of a rape when I was 17 years old. I need to tell you that I am no longer a victim of rape, but a survivor. My dysautonomia is basically a dysfunction of the autonomic nervous system. This results in multiple system disorders, including heart problems and blackouts, and I recently just had a device put in for my heart. These symptoms have caused me to struggle through college and have made working very difficult at times. I should also tell you that this illness affects many people, especially young women in their early 20s. I was expecting that in December of this year, I would be off my parents' health insurance and I would not have completed my college education yet. It was very, very scary. Instead of looking forward to my future, I had fears of being considered uninsurable based on my health history and worried about facing tens, even hundreds of thousands of dollars in potential medical bills. A medical bankruptcy in my 20s, not exactly something I wanted to think about. As a result of health care reform and the changes we will see tomorrow, I have hope. Hope for being able to complete my college education and still have health insurance under my parents' plan. It also gives me time to work with my doctors to work on a care management plan for my dysautonomia so I can function more fully at school and at work. I am so thankful to this administration and their hard work to make health care reform a reality. There are many young people my age with chronic illnesses that were facing these same fears of being uninsured and being denied insurance due to pre-existing conditions. My future is brighter today because of healthcare reform, and it will be even brighter tomorrow. Thank you again for the opportunity to speak with you all today.
So two powerful stories. Before I bring up our next speaker, I want to acknowledge some of the champions in the room who have led this fight at the state level and have been part of working towards change at the federal level as well. So Senator Berglund, Senator Marty, Representative Huntley, Representative Thiessen, Representative Murphy have been true champions in the effort to advance healthcare in the state. We thank you for all that you've done as well. We're very excited to have Cristal Thomas from the US Department of Health and Human Services with us today. Ms. Thomas, who flew in from Chicago this morning, is the regional director in charge of 6 states in the Midwest, which is nearly 20% of our country's population. She's going to outline the benefits coming our way as a result of the Affordable Health Care Act and is around to answer questions after we finish up here as well. So Cristal, please, thank you.
Good afternoon, everyone. I want to thank TakeAction Minnesota, as well as all of you for being here today and for the legislative champions as well. This really is an exciting day for us at Health and Human Services and for millions of Americans who are going to be benefiting from the new consumer protections that we're talking about today. And when President Obama came into office, he promised to put our country back on the right path. And we have taken on some of our nation's toughest challenges and work together to give every American powerful new opportunities and tools to provide a healthier and more financially secure life for themselves and their families. Together, we've begun to create a more competitive and consumer-friendly healthcare marketplace to to crack down on the worst insurance company practices and to help bring real benefits to people who need relief. And that's why we're here today, because thanks to the Affordable Care Act, there are key new consumer protections and Patients' Bill of Rights that are going into effect to make sure that insurance is there for people when they need it. And why is this important? It's because we hear these stories all the time. We just heard two powerful stories of people who needed help, who needed the opportunity to remain healthy or for their families to remain healthy, and now have that opportunity. We hear about people whose insurance companies has refused to cover a procedure because they claimed it's for a pre-existing condition, or whose policy was rescinded in the middle of a life-saving treatment because the insurance company claimed that they made a mistake or a small paperwork error on their application, or the family with a sick child that reached their lifetime benefit limits and now won't be able to afford to continue treatment. We had to act because these are our friends, our families, and our neighbors. People who did the right thing, got covered, paid their premiums, and thought that they were covered, only to face harsh realities. So let me take a few minutes to talk about some of these new protections that are going into effect starting tomorrow, and that will begin benefiting people now. Under the Affordable Care Act, insurance companies will no longer be able to deny coverage to a child under age 19 due to a pre-existing condition. So if a child is born with or develops some type of chronic condition, families can now have the security of knowing that they will still be able to get coverage for that child, even regardless of whether they may lose their job or lose employer-sponsored coverage. And children will be able to stay on their parents' health insurance until they reach age 26, regardless of whether they are in school or whether they're working or financially independent or whether they're even married. And the new law prohibits insurance companies from rescinding or retroactively dropping coverage when a person gets sick for an arbitrary reason that they come up with on a paperwork error or an application. And it eliminates lifetime dollar limits on benefits and the amount of care that will be covered under a plan, which will give real security to families who have insurance coverage and think that they are covered, but then experience some type of catastrophic illness or condition and think that they're covered, and suddenly they've maxed out a lifetime benefit limit. That will be a thing of the past. And it also requires new insurance plans to cover key preventive services without copays or cost sharing, so that people who want to take care of their health, who want to make sure that they are doing the things they need to do, getting the tests and the screenings that they need to stay healthy, are able to do so without having to pay out of pocket. And starting next year in 2011, Medicare will also be covering the cost of seniors' annual wellness visits and preventive services. And many small businesses are getting tax credits this year to make it easier for them to provide coverage for their workers. So these are some of the reforms that are in the Affordable Care Act and that will be protecting consumers moving forward, and even more consumers as they renew coverage and enroll in new plans that go into effect after tomorrow. They mark a turning point in our insurance industry and our healthcare system that is no longer business as usual. And it's important to keep in mind that as these reforms go into place, they are a bridge to 2014, because that's when even more exciting reforms go into effect under the Affordable Care Act. There will be new health insurance exchanges where people will be able to shop for and purchase insurance coverage, and will experience a tax cut and affordability credits in order to make that coverage affordable for them in the exchange marketplace. The hard work is already taking place here in Minnesota and across the country to bring these benefits to people. Since the new law passed, the Department of Health and Human Services has actively partnered with governors, state health officials, community leaders, healthcare providers, and patient advocates to educate people and to implement the provisions of this new law. And we will continue to work with our partners in the coming weeks and months to make sure that Americans have health insurance security and are able to get more control over their health care. So once again, I want to thank you for the opportunity for being here today. And I want to thank everyone who's participated in this, and particularly Julie and Mark, who shared their stories with us. And with that, I will turn it back.
Sure. So this is the first step in a long way, but we've achieved something great. So how about a round of applause for all the people that have We're happy to field any questions here from members of the media, but otherwise I'd suggest maybe we get some cake and mingle, and if there are any questions that folks have to follow up, they can just do that, all right? So Greta, to the cake. Let's do this.
Great.
I think this is going to be great to get the word out about all the great things that are in this bill.
This is a great day for people in Minnesota to have greater health care security. People with children who have pre-existing conditions will have access to health care. Parents of young people will be able to keep them on their health insurance.
Well, this is a huge day for American health care. It's the biggest thing since 1965 when Medicare and medical assistance were passed. This is a huge step on the way to universal coverage, where the United States could join the rest of the industrialized world and cover all their citizens. So I think it's a good step. We're still going to have lots of work to do over the next 3.5 years.
I actually heard Senator Dayton refer to your plan last week at the Take Action endorsement. He specifically, in the small group that I was in, referred to you and your plan as being a guideline that he wanted to follow.
Mark is somebody who will follow through on it too. Mark
Yes.
is a courageous guy, and he's,
Yes.
we just gotta make sure the election works right, because, well, your two cases multiplied by tens of thousands of people.
In addition to what we've talked about today, there really are a lot of benefits in the Affordable Care Act that young adults and that students should be aware of, both right now, being able to benefit from staying on their parents' health insurance, receiving preventive services without cost sharing. I didn't have a chance to mention, but for seniors, the Medicare program is being strengthened under the Affordable Care Act, and the prescription drug donut hole in Medicare Part D is being closed over time. Seniors have begun to receive $250 rebate checks starting this summer when they go into that donut hole, and that's something that is providing real relief for millions of seniors across the country.
You want to comment on the states threatening to opt out?
No.
Maybe she'll be a camera hog. Maybe that will do it. I don't know.
That's a good idea.